150,000 mothers die each year from postpartum hemorrhage, with a majority of these deaths occurring in developing countries. Postpartum hemorrhage, or PPH, is the loss of more than 500 milliliters of blood 24 hours after delivery. The most common cause of this bleeding is uterine atony, when the uterus does not contract back to its normal size after birth. The body's natural response to contract the uterus compresses and closes the hemorrhaging uterine blood vessels. Current PPH treatments include uteronics, which are drugs that help the uterus contract. These drugs are very difficult to store and not readily available in developing countries. The intrauterine balloon tamponade is a balloon that is inserted into the uterus and inflated. This option is expensive and causes the uterus to expand rather than the natural physiological contraction. External compression garments are worn to constrict blood flow in the lower body and press down on the uterus. This method is often not effective to stop PPH. Surgical interventions are recommended if more conservative options are not successful, but in developing countries, surgery is often not an option. Unfortunately, all of these options are too expensive, too complex, and not readily available to a vast majority of mothers with PPH. The UVAC, or uterine vacuum-assisted contraction device, is designed to specifically address these issues. It is inexpensive, easy to use, and an effective device for treating postpartum hemorrhage in a variety of settings. The device consists of a large perforated catheter that is inserted into the uterus and a seal which is positioned at the introitus. A vacuum is applied and the uterus contracts, naturally compressing the spiral arteries and veins and decreasing blood loss. Our device is designed for global use as a reusable product and as a disposable product in the US.
In 2015, the total size of the PPH treatment market was over $600 million. Our initial target segment only includes the regions of developing countries, so the overall size of our target market is $250 million. Our research shows that growth within our target segment is more promising than the US or Europe. The average growth rate of our target market is estimated to be 5.6% for the next 8 years. Our direct competition is the uterine balloon tamponade because it is an insertable device and has the largest market share. The uterine balloon tamponade is a single-use product with an average price of around $400. The UVAC will be sold for only $25 and is intended to be sterilized and reused. Our unique vacuum device will disrupt this market. A key factor for success in the PPH market is to have established marketing and global distribution channels. We are currently in collaboration with Clinical Innovations, a global women's health company already in the PPH market. Our partnership with Clinical Innovations will allow us to use their existing manufacturing and distribution networks to get our device to market faster. The UVAC is a simple, affordable, reusable device to solve postpartum hemorrhaging.